Trump's dismissal of his own serious condition, an infection from the coronavirus, and the increasing outbreak happening within his own home and office, of course, underscores how the Trump administration has handled this pandemic all along, recklessly. According to the New York Times, the White House has decided not to trace the contacts of guests and staff members that attended the Rose Garden ceremony for Judge Amy Coney Barrett last weekend, where most attendees could be seen not wearing masks and not a lot of social distancing went on. 11 people who attended that event, including the president and first lady, have since tested positive. It's a stunning but predictable decision as this country grapples with loss under Trump's lack of leadership. More than 7.5 million COVID cases and more than 211,000 souls lost. Joining our conversation is field epidemiologist at the UCLA Fielding School of Public Health, Anne Ramoyne. Also with us, Elise Jordan, contributor to Time Magazine and an MSNBC political analyst. Eli and Jason are also still here. Dr. Ramoyne, what is your degree of concern about this White House? We learned of more infections today. We learned that many members of our military are self-isolating and quarantining. How vast could this outbreak be?
This is a super spreader event and the most high profile and possibly one of the largest in history we have going on here. And the White House has been abdicating all responsibility, doing what we know is necessary to be able to contain this outbreak. We need contact tracing, which is the backbone of any epidemiologic investigation into a deadly virus cluster. And we have the president's physician, Dr. Conley, who is an osteopath, not an infectious disease physician or epidemiologist, leading the medical unit, who is leading the investigation, who just said on national news yesterday that he's not interested in looking backward. Well, looking backwards is actually the backbone of any epidemiologic investigation, which is what is required to be able to understand who's been infected, how they've been infected, and how we can look going forward to stopping chains of transmission. We are actually ignoring all common sense and public health knowledge to date by avoiding doing the kind of contact tracing that is required to be able to stop what is not only just a threat to public health, but a threat to national security.
Can you just, since it's not happening, what should happen? I mean, should everyone who was in the Rose Garden and then went back and got on airplanes and flew home, should they contact the airlines and tell the airlines to let everyone on the flights know? I mean, there were other members of the cabinet there. There were other senators there. Whether people have symptoms or not, what should they do?
So ideally, everybody needs to follow CDC guidelines, and that is, if you know you have been exposed or may have been exposed to somebody who has COVID-19, you should quarantine for 14 days. We also recommend that you get tested, because if you are positive, we then need to contact other people that you've been in contact with. It also helps guide your treatment, because the sooner that you know you're positive, the sooner that we can start monitoring for symptoms that could be of concern. The other thing is that anybody who has COVID, anybody who is who has COVID-19 disease, what they need to do is they need to isolate, and they need to isolate for at least 10 days until they are no longer having a fever with fever-reducing medications and their symptoms are resolving. But for people who are immunocompromised or who are having severe disease, that isolation period can extend up to 20 days and potentially even longer. CDC recommends that you ask your physician for guidance in that scenario, which would potentially be the scenario of our president.
So, Elise, here's where we are. Chris Christie remains hospitalized. Hope Hicks is sick with coronavirus. Bill Steppe and the campaign manager is sick with coronavirus. Kayleigh McEnany, the press secretary, sick with coronavirus. I believe we're up to 3 or 4 of her deputies are sick with coronavirus. This was a workplace that was all of the worst practices known to mankind at this, the 8th month of the coronavirus pandemic. No one wore masks. They didn't just fail to social distance, but they showcased it in their television productions of life at this White House. There was mask shaming. Donald Trump, from his podium, would mock and taunt reporters who wore masks. There are actually 4 members of the White House press corps who have tested positive. I mean, if the public renders a harsh judgment of Donald Trump in 28 days, it will at least in part be because of his cruelty with his own staff and the people closest to him, the resident staff, the Secret Service agents, people who work for the American presidency, not Donald Trump personally.
Nicole, having worked in President Bush's White House, and you know the tiny size of the West Wing and the close proximity, I'm really grateful that this was just never even a call. If you had the flu, you were supposed to stay home. I remember the chief speechwriter having the flu before, I believe it was the first inaugural, and had to specifically stay away from President Bush and went out of his way to avoid giving the president the flu because other people mattered. Watching the blatant disregard for everyone down the totem pole from the president, that he just absolutely does not care, that he doesn't care about the hundreds of workers on the complex who keep the White House as a pristine example of American democracy and a monument and testament to our history. All of those workers, it is absolutely mind-blowing. And I can't help but to feel that voters, especially as we've seen senior citizens reflected in polls, are going to judge him for that too.
You know, Jason Johnson, I want to read you some of Axios's reporting. There's an extraordinary body of reporting from Eli's paper and really everyone that covers this White House. A White House source told Axios, quote, "It's insane that he would return to the White House and jeopardize his staff's health when we are still learning of new cases among senior staff. This place is a cesspool." The AP reported that it was a ghost town. So an abandoned cesspool is what Donald Trump has done to what Elise just described, what is really a really special place.
An abandoned cesspool, the swamp, a septic tank. I mean, who wants to be around this person? There were other reports I read about the Secret Service saying this guy clearly does not care about us if he wants to get us sick. And I think, you know, we're seeing it in the people who've been close to Donald Trump. It's not like he's ever been a particularly loyal or considerate person. But if we backtrack through this, it's not just Christie and Hope Hicks. It goes all the way back to Herman Cain. Herman Cain going to a rally and passing away after he thought it was fine. It goes back to the fact, and I don't think this can be overlooked, that the Trump campaign came to the first debate late, so they couldn't get tested, which means they knew there was a possibility of infecting people on the Biden campaign. The callous disregard for the lives, even of people who like him, is horrifying. And we've seen this over the years, but I think now that it's in an enclosed space, now that you've got over 100 people between the Capitol and the White House who are getting sick, who can't do their jobs, who can't be track and trace, so they could be taking this home, we're seeing a presidency that clearly not only doesn't want to do their basic job, but doesn't care if other people die. And that's the point that's clear. This is not just about getting sick. This is not being inconvenienced. People could die. And Donald Trump doesn't care. Donald Trump wants to talk about where he was 20 years ago. Donald Trump wants to rip off his Mac like he's Hulk Hogan in the 80s tearing off a shirt, while you've got people who have dedicated their lives and sacrificed their political integrity for you who are possibly on respirators. And I don't know how any American can watch this behavior right now and say, I want 4 more years of this, when he clearly doesn't care about the lives of those who have been most dedicated to him.
I mean, to that end, Dr. Ramon, the New York Times also reports under this headline, for the Secret Service, a new question, who will protect them from Trump? And if you look at today's polls, that's a question on the minds of a lot of Americans. What does Trump have to watch out for? From the public reports of his condition and his therapies, which included, it would appear, some supplemental oxygen, some steroids, behavior last night that showed him really laboring to breathe when he got back to the White House. What is your assessment? And again, we don't want to suggest that you're treating him, but with all your expertise, what is your take of how he's doing?
Well, what I can say is that there's no way to predict what's going to happen. And Donald Trump can't predict what's going to happen. He is, like anybody else who is infected with coronavirus, subject to whatever the virus decides it's going to do in his body and his own immune system. And he is very lucky to have such incredible care, access to things that most people in the world do not have access to. In fact, I don't think anybody has access to the care that he has available to him right now. But because we still don't know when he had his last negative test, we don't really know where he is in the course of his disease. If he tested positive for the first time on Thursday, he's only a few days in, and he must have gotten sick pretty quickly. And we know that somewhere around the second week, people can get even sicker. So we don't know what's going to happen to him. Of course, I do want to just point this out again. We don't know when his last negative test was. And so he could be much further along in the disease process than we know. And of course, that information would be critical to be able to save lives right now, because this deadly virus is running rampant in a major super spreader event, not just through the White House, the Senate, the Joint Chiefs of Staff, the donor populations that he was with, the Rose Garden, the rallies. Nobody knows, really, the debate. We really don't know at this point how many people the president has exposed.
It's a terrifying thought. Anne Ramoyne, Eli Stokols, thank you both for spending some time with us today. Elise and Jason are sticking around. When we come